Hey guys, it's Medicosis Perfect Channels where medicine makes perfect sense. Today we have a premium video in rheumatology. It's called osteomyelitis. Itis means inflammation. Myelo means a marrow or a core, what's on the inside. And osteo means bone. Osteomyelitis is an acute or chronic bone infection, and it's usually bacterial and it's usually Staph aureus. With that being said, now let's get started. Generally speaking, bone infections lead to bone destruction and necrosis, as well as new bone formation. This is an and, not an or. Bone destruction, necrosis. The necrosis could be single or multiple, but very small, or it could be massive. If it's single, it's going to be dissolved and removed by the great inflammatory cells. But if it's a bad, ugly, massive necrosis, it's going to form a bulk of dead bone, and it's going to persist and stay, and it's not going to be cleared. And in case of osteomyelitis, we have two types of this bone. In the beginning, it's called sequestrum. And on top of this sequestrum, you have involucrum. The involucrum acts as an envelope, and it's called involucrum. It's the crumb of the earth. It's the crumb of the bone. It's very irregular. And we have also no bone formation thanks to the great osteoblasts. So this is an osteolytic lesion, this is an osteoblastic lesion. Which one is going to appear on nuclear bone scans? Only the blastic. Osteomyelitis, itis, inflammation, myel, marrow or core, osteobone, acute or chronic infection of bone and the bone marrow. The nasty bacteria, also known as Staph aureus, comes through the blood or through direct spread, and it comes to the bone. Where exactly? To the metaphysis. Okay, after going to the metaphysis, can it just go to the epiphysis? No. Why? There is a cartilage plate here, baby. What are the most common bacterial organisms that can cause osteomyelitis? Staph aureus is by far the most common one, hands down. Streptococci, so staph and strept, not to be confused with chicken strep. Salmonella, especially in sickle cell disease, it's usually Salmonella paratyphi, and Brucella, not to be confused with Bruce. Is it always bacterial? No, not always, but most of the time. It could be viral, it could be fungal as well. Metaphysis. Why the metaphysis? It has dilated marrow spaces like this. It has cancellous bone, which is like less strong than the compact bone. And also it has sluggish circulations called loop vascular supply system. It's like this, blood vessel coming up and coming down and coming up and coming down. This gives the bacteria a chance to stay in this location for a longer period of time, causing stagnation and inflammation, etc. This is an ugly, nasty pyogenic infection, and pyo means pus. This pus can penetrate the Haversian system, leading to subperiosteal abscess like this. Here's the bone, and here's the periosteum, and it's elevated like this, and here's the pus underneath. Gunk. This will increase the intraosseous pressure, which will lead to bone necrosis. And then the bone necrosis can spread to the periosteum, and the periosteum can increase the pressure, lead to bone necrosis. It's ugly. Do we see osteomyelitis that often today? And the answer is no, thanks to a very nice Scottish guy called Alexander Fleming. Thank you, sir. How did this ugly infection end up in your bone? We have two routes, direct spread and hematological spread. Direct, tissue, very close to the bone, boom, to the bone, such as dental abscess in the teeth, and the teeth is the bone. Frontal sinusitis to the skull bone, deep bed sores, sacral osteomyelitis, and the sacrum is a bone. Diabetic foot ulcer, infected, contaminated, bone. Open fracture, contaminated, bone. That's why in these cases, and in all of these cases, if it's too late, we may need to amputate. Penetrating wounds due to trauma or historically in wars. Foreign body implants such as surgical devices, contamination, bone. This is the direct route. The hematogenous route is different. You start with infection, let's say in your teeth, abscess on the skin surface, upper respiratory tract infection, endocarditis, which involves the valves, and even a urinary tract infection or IV drug use, because the IV drug use goes to the vein, and then from the vein to the right side of the heart, and then from the right side of the heart to the lung, and then to the left side of the heart, and then to everywhere else, including the bone and bone marrow, aka osteomyelitis. We call this septicemia or pyemia, a septic embolus floating in the blood until it infects other organs. Bacteremia goes to the bone, especially the metaphysis, because of the loop vascular supply system. Then it starts to spread in every direction. But thanks to this cartilage plate, also known as epiphyseal cartilage plate, it's gonna prevent the spread of infection into the epiphysis. That's why the epiphysis is happy, at least in the beginning. But if you destroy the whole freaking bone, yeah, in the end it's gonna affect the epiphysis. But this is gonna be too late. The infection can spread underneath the periosteum. Look at this name. Peri means around. Osteum is the bone. It's the layer around the bone, leading to subperiosteal abscess. At this time, we have lots of inflammatory cells and white blood cells, and you'll find and feel the symptoms of acute toxemia, septicemia, and pyemia, such as fever, tachycardia, leukocytosis, etc., and so on and so forth. Next, since the periosteum is now elevated, on top of that periosteum you'll start forming new bone underneath the periosteum, because now we have more space to make more bone, and this is going to be called the sequestrum later. Back to the stage, this infection, this purulent gunk, can infect soft tissue and even the skin, leading to skin abscess, for instance. The area underneath the periosteum has become the sequestrum. The periosteum itself has been ossified and it's now called the involucrum. So the involucrum is the envelope around the sequestrum. So what about here? What about a piece of necrotic bone here? Sequestrum. How about here? Sequestrum. Underneath the periosteum, still sequestrum. At the periosteum side, involucrum. And they are not the same. Involucrum is very irregular, and I call it the crumb of the bone, involucrum. This purulent infection can open a sinus through the tissue, and it can open on the skin surface. Complications of osteomyelitis: septic arthritis, so joint, alteration of bone mechanism leading to growth disruption and pathological fractures. So if it happened to a child, the child can get growth abnormalities. Spread of infection can lead to septicemia or pyemia. There is a septic embolus in the blood leading to disseminated abscesses. Abscesses everywhere. It can lead to endocarditis, can lead to lung abscess. And when lung abscess is caused by inhalation or of oropharyngeal material, it's usually singular. But when it comes via septicemia/pyemia, it's usually multiple, small, and in the lower lobes. That's a big difference. Next, vertebral osteomyelitis leading to compression fractures of the vertebra, collapse of the vertebral column, cord compression leading to myelopathy and radiculopathy. So here is the deal. Here's your nice spinal cord, and some nerves will start to exit, and then they become peripheral nerves, and then they go to supply the nice muscle. If you inflamed or infected the spinal cord itself, this is called myelopathy or myelitis. If you injured the nerve at the spinal cord's root while exiting to become a peripheral nerve, while leaving the spinal cord through the spinal foramina, this is called a radiculopathy. If you injured the nerve peripherally, this is called peripheral neuropathy or peripheral neuritis or whatever. So, myelopathy, radiculopathy, neuropathy. Fine, and all of these are neurological symptoms. Imagine my shock. Chronic osteomyelitis can lead to secondary amyloidosis. Imagine my shock, because secondary amyloidosis comes to any chronic inflammation whatsoever, and here it has the SAA protein, not the AL. AL is primary amyloidosis, such as cases of multiple myeloma, as we have discussed before, and it can also lead to squamous cell carcinoma. Horrible stuff. Primary TB is the first infection. It has the Gons complex, a subpleural tuberculosis, TB lymphangitis, TB lymphadenitis, the lymph nodes. Secondary TB happens later due to reactivation or reinfection, and it's upper lobe and usually cavity. And you will have lots of caseating granuloma. If your immunity is weak, it can disseminate to literally every organ, including your bone, causing TB osteomyelitis, including your vertebra, causing TB vertebral osteomyelitis, also known as Pott's disease. In primary TB, only 4 organs are affected, and it's usually the lung. In secondary TB, if your immunity is weak, it's gonna lead to any organ, including the bone leading to osteomyelitis, and the vertebra leading to Pott's disease, and later it's going to lead to cold abscess, which is going to involve the body and the disc, but this happens later on. So let's talk about tuberculosis in bones and joint. Is it primary or secondary? Usually secondary in more than like 98% of cases, or 99. How about the remaining 1%? Yeah, it can happen in primary if your immunity is really weak, and this is extremely rare. So here's the story. You start with primary TB, then hematogenous spread, and then the second time is called secondary TB. What caused the transition from primary to secondary? Either reinfection or reactivation. Secondary TB can go to the blood if your immunity is weak and goes to the bone, vertebra, etc. It's purely an osteolytic lesion, not blastic. No reactive bone formation, no osteoblasts involvement, and it usually affects the metaphysis, and it can spread to the joint. We call this TB arthritis. TB can also involve the synovium, leading to caseating granuloma. The caseating granuloma at the synovium can go to the bone again to form even more infection, and subchondral bone. TB osteomyelitis affects long bones, secondary tuberculosis usually, primary osteolytics with no reactive bone formation, secondary TB of the bone, caseating granuloma, and it usually affects the metaphysis. And we're talking about adults because this is an internal medicine lecture. How about the kids? Epiphysis. TB can even involve the joint space, the joint, the articular cartilage, and maybe the medulla and the synovium. TB osteomyelitis of the spine, also known as Pott disease, where the lower thoracic and lumbar vertebra specifically. Where exactly? Anterior part of the vertebral body. Note, early on TB spares the lamina, spares the spine, spares the adjacent vertebra. TB early on also does not involve the disc, but later it does affect the disc and it does spread to everywhere, and it's the nasty cold abscess. So, here how it goes. Pelvic venous plexus. Through retrograde venous spread, it can goes up until it reaches the perivertebral venous plexus, leading to osteolytic problems, vertebral collapse, leading to kyphosis, scoliosis, kyphoscoliosis. What are the complications of TB osteomyelitis of the spine, also known as Pott's disease? Complications include cold abscess. What do you mean? Normally, when you have an inflammation and you're healthy, you'll have redness, hotness, swelling, pain, loss of function. Look at this, hotness. But when you have a very weak immunity, you cannot produce all of this. You cannot produce hotness. You end up with a cold abscess. And this can spread through the psoas muscle. As you know, the vertebrae are here. So let's draw some nice vertebrae. And here is your nice psoas muscle. One to the right, one to the left. And then the TB cold abscess here in the vertebra can pew, 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 until you end up with psoas cold abscess. And it can even reach the anterior spinal ligament, which is here. And this is going to lead to cold paraspinal abscess. It can lead to compression fracture of the vertebra, which is an upper motor neuron lesion. Whether myelopathy or radiculopathy, I don't care. Either one can lead to paraplegia, which is bad. Spinal deformity, such as kyphoscoliosis. I've talked about all of this in my first lecture in my pulmonology playlist, and it was called Clinically Oriented Anatomy of the Thorax. In brief, if you have a descending thoracic aortic aneurysm, it's going to involve only the body, not the disc. If you have metastasis from a cancer coming to your vertebral column, it's going to involve the vertebral body only, but not the disc. Why not? Because the disc is avascular. It's cartilage, honey, and we're talking about hematogenous spread here. Think. How about tuberculosis, also known as Pott's disease, which is a secondary TB? In the beginning, only body. But then later, when you form a cold abscess with no pus, it can involve the body and the disc, and it can spread to the anterior spinal ligament, or it can spread through the psoas muscle. Some complications of osteomyelitis. Septic arthritis. As you know, septic arthritis is bacterial infection of the joint. Arthro means joint. Could be due to direct invasion from penetrating injury, such as in wars or in trauma or gunshot wounds. Osteomyelitis, or due to surgery. You'll have increased white blood cells, usually neutrophils, like a lot of them. This can lead to destruction of the hyaline cartilage, leading to fibrosis and ankylosis. Ankylosis means fusion, not to be confused with Gillette products. We talked about the results of arthrocentesis before. If we are talking about septic arthritis, we're talking about a purulent inflammation. We have opaque synovial fluid, which is yellow to green, and more than 100,000 white blood cells within the joint space, within the sample. And of course, it's more than 75% of these white blood cells are neutrophils. The culture is usually positive, but not always. Brief discussion. Gonococcal arthritis, a special type of septic arthritis. Genital infection, spread, bacteremia, gonococcal arthritis. Lyme disease, spirochetal infection by Borrelia burgdorferi, a deer tick or Exodes tick, and it's going to lead to joint problems, cardiac problems, CNS problems such as bilateral Bell's palsy, which is the 7th cranial nerve, also known as the facial, and the cardiac can lead to 3rd degree heart block. Brucellosis, especially chronic, non-caseating granuloma, you diagnose it by serology, culture is usually a failure. Chronic brucellosis can lead to a low-grade osteitis of the spine. Viral arthritis could be caused by rubella virus, hepatitis B virus, or parvo. It's a non-destructive arthritis and it has no bacteria. We call it aseptic arthritis. Same thing in case of meningitis. If we have a viral cause, we call it aseptic meningitis, which means it's not bacterial. This video was possible by a generous support from a very nice lady who is a medical student. So guys, if you need, please support this channel. You can go to paypal.me/perfectionalis and leave a tip. And if you'd like me to produce a video just for you at your request, you can go to patreon.com/medicosis. Thank you for watching. As always, be safe, stay happy, and study hard. Until next time, please subscribe.